Hey, we're about to go live, and it says that our meeting is being streamed. Welcome, everybody. If you're joining us, we are here on the BChip Facebook page, welcoming you to 2024. I have with me Executive Director Extraordinaire Kim Everett, who is here to give us an update about not only the big initiatives of BChip for the year, maybe just the quarter, I don't know how much time we're going to have, but also what else they offer. So Kim, how's the start of 2024 for you?
Oh, exciting, actually. So happy New Year. And thanks for providing this opportunity today. Yes, BChip is really excited for 2024. We were able to finish that strategic plan that we talked about, I think, before. And so we finished that up in 2023. And so I feel like we have some really good direction. And as we're looking at our priorities, there are things that we've identified that our health systems and our community partners can collaborate around because they have similar needs. So the first thing that stands out to me is healthcare staffing. We know that that is a problem, not just locally, but across the country as well. And making sure that we have adequate staff in our communities. Most people, when they think of healthcare staffing, they think of doctors and they think of nurses. They might think of a tech here or there, but they don't think of all of the positions that are needed to make a health system run.
Right.
So we are working with the Bucks County Workforce and Economic Development Task Force.
Great.
As well as the Bucks County Intermediate Unit, which connects us to our local school districts, and then the health systems. And we're hoping to do a big campaign this year around careers helping people. So we need to secure some funding for that, but realizing that young people can have career pathwaying. So we have to stop thinking of that traditional way of I need to graduate and go to a four-year college. For some kids, that's fantastic and it works well. So we're not against that, and certainly not, trying to not encourage young people to go to college. But there's other opportunities. If you think you're interested in healthcare, you can get a certificate program in a very short amount of time to be a surgical tech or a patient tech, and you can work in healthcare to see if you like healthcare. And while you're there, most of our health systems offer tuition reimbursement, and you can take classes and you can go on to get your associate's degree, your bachelor's degree, your master's degree, all without any debt if you want to take the time to do it slowly.
Yeah, and there's also that great program through Bucks County that allows someone to even finish their degree.
Yes, we talked about that one time before. Yes, there's this grant there that the county has for somebody who started their program and decided that they want to go back and finish. And there's certain qualifications to it, but there's a lot of opportunities for young people, or not just young people, someone who wants to change their career. We've seen a lot of people post-COVID say, oh, maybe I want to do something a little different, right? So trying to encourage folks to consider some of those careers. We need mental health technicians. We need, social workers, case managers. There's just so many roles in healthcare. We even need people to paint the place and to be involved in technology and computers. And so there's all kinds of careers in healthcare that are not just health related. And we need to try to grow the pool of folks for them to draw from.
Yeah, and I just want to say now is the time to consider a career change because there are an endless number of jobs. I don't know any business that is fully staffed.
Exactly.
You go anywhere, and especially in healthcare, now you're leaving messages on doctors and answering machines that they don't even have the staff to return them. So it's getting very dicey out there. So you want to make a change, you go make your change, go find your why.
Exactly. So it's really nice because we have all the vice presidents of human resources for the 6 health systems in Bucks County. So they're meeting regularly with our community partners to say, what can we do together instead of shooting each other in the foot, competing for all the same talent. So that's what our role is here in BChip, is bringing those players together to work on that one issue in a way that is going to be hopefully more productive.
Fantastic.
So say that again.
What else you got?
Oh, what else we got? So the other thing we talked about last time a little bit is that violence in healthcare task force. So we're moving some of that work forward, especially around data, but trying to get some of those key stakeholders to the table and connecting folks with with NOVA, the Network of Victims Assistance, so that if there is someone who is a victim of violence in healthcare, they're familiar with those community resources. The DA's office is actually getting ready to go out and do some presentations in the health systems so that folks, if they are a victim of violence in a healthcare setting, they know their options and how it works for them if they decide they want to press charges. So there's that initiative, which we're pretty excited about. And then we have the long-term care partnership. So that we launched just over a year ago now. And it's a model that we want to work similar to how our BCHIP Board of Directors works. And that's where we're bringing the 32 nursing homes together here in Bucks County. We know that we don't have enough resources in our skilled nursing facilities. But that became abundantly clear, right, through COVID. So we want to bring those leaders together in a model that is very similar to what we do with BCHIP to say, what are best practices? Where can we share resources? Even though they may be competing organizations, how do they work together to improve care of their patients? And so we launched that, like I said, just over a year ago. We have buy-in from at least 28 of the 32 nursing facilities to participate in the group. And what we're going to do is we're going to use that BCHIP model of all the committees we have in BCHIP and pull the long-term care partners into those committees so that there's representation across the board for all patient communities. So for instance, we already have a behavioral health committee. So we're going to invite the nursing homes to have representation there. Or in this violence and healthcare task force we developed, we will now invite long-term care to participate there. So as BCHIP has this other work that we do, we're going to bring the long-term care community in there so that we can hopefully improve those transitions of care and provide similar resources to them that we do for our healthcare systems.
Yeah, that's amazing. And I know organizations tend to be a little territorial, right? But there's nothing wrong with sharing ideas, establishing best practices, and saying, wow, this isn't working for these two organizations, but maybe if they, who knows, right? Merge, share a board, share an executive director, money can be saved. Or, hey, that's not working. We got to separate these two. And that can be very helpful as well. But that's one thing that I love about the BCHIP organization is that it kind of bridges those gaps to start to talk about, okay, what can we do here to make things better?
Exactly. And I always talk about that BCARES program that the county truly leads. It's on our BCHIP website, and I always laugh and tell folks that we're not trying to take credit for work that we don't do. The county really does do that work. But in true BCHIP model, what we do is we bring those 6 hospitals together to implement that warm handoff program. They all have to make it different for their own organization, which is, again, that's okay. But what are those best practices? And because of BCHIP, they all agree to have that warm handoff program for patients with substance use disorder. So that's just a great example. And that's the example we're giving also to the skilled nursing facilities to say, this particular issue might not be the one that's a priority for you, but it is the model that even though you're all competing organizations, you're dealing with some of the same challenges. So how do you work together to address them? And how do we get resources to meet the needs of what your highest priorities are?
Fantastic. So what else are you guys offering right now? Like you got
So,
nothing else on your plate, right?
so it's January. We all have our New Year's resolutions. So we have our smoking cessation classes. They are, of course, always very popular this time of year, people making that commitment to stop smoking. So we have those available virtual or live. And so that's something that BCHIP's been committed to for many years, includes that nicotine replacement therapy, and all the sessions are free. So we have that program. The other thing that some people make a commitment to do in the new year is to kind of get their documents in order or get their finances in order. And so we have the Living Will program where we do the advanced care planning. We do not do financial wills, always to clarify that, but we do the Living Will and healthcare agent form, and we do that free. So we are seeing an uptick of that a little bit. And we have a class coming up for anyone who's interested in getting trained as a facilitator. So we're looking forward to that. We do need volunteers for that program. So while it may not be the most exciting topic to talk about with folks, we know that it's something that is really important. And so if someone has a history, maybe they're a retired nurse that worked in long-term care, or maybe they've worked in hospice, or maybe they're just a retired, they don't have to be a nurse. They're someone who feels comfortable talking with folks about making life decisions and coaching them through it. You don't need a healthcare background at all. They can attend the training for free. And we do ask that they make a commitment up front to a certain number of conversations, but then they would meet with folks and provide that service. So that's something else we have going on.
That's phenomenal. Wow. Okay. And then always the immunization work that you guys do, making sure that people have access.
Thank you for reminding me. So yes, and we did, of course, we have our immunization work. It's great. And I will tell you that what's really neat is our homebound program now has expanded so that we can include all lifetime recommended vaccines for our homebound patients. So folks do have to be truly homebound, but right now we're doing RSV. So we went from flu and COVID to now we're doing the RSV vaccines and others. So very happy to be able to provide that service. We're cautious. We want to make sure that it's not one that's taken advantage of. We want folks that are truly homebound, not someone who just didn't want to get in the car and drive to the grocery store, if I'm really
That would be
honest.
me.
Right? But we do have that service available for true homebound clients, and so they can get all recommended vaccines in their home. So that just was a recent expansion of that program. Hannah's doing a great job.
Great. And we're still vaccinating for COVID, correct?
We are, of course, yes, and that is available as well.
Okay.
And we know that the rates for COVID vaccination are currently not as high as we would like. And so we certainly want folks to get out and get their COVID vaccine. We know that there's all kinds of nasty stuff going on right now. And while the vaccine may not prevent the disease, we do still believe it prevents the severity of that disease, very similar to a flu vaccine. So we're always encouraging folks to get their COVID and flu vaccine.
Yeah, after the ick that I had in December, I would take any vaccine to never go through that again. It was so bad. So
It's yucky. It's yucky. I know. I had COVID again in the fall and
right.
led to a sinus infection, which lasted forever. And so I know it's just yucky. It's just yucky stuff. It's not fun.
Ugh, right. Okay. Any parting thoughts?
I just encouraging everyone to, as it's that time of year where we do tend to make those resolutions, to think about some of the things that BCHIP is offering, to see if they can support them in their mission to better health. And we look forward to continuing to move these initiatives forward to try to improve the health of Bucks County. That's what we do. So excited and feeling really energized and looking forward to it.
Great. Well, as always, you are delightful to talk to and a source of energy yourself. So thank you for your time. For our audience, I'm hoping that someday we can say our fans, we will be back in 2 weeks, like we do these every 2 weeks. So we look forward to seeing you in 2 weeks in middle to late January. And Kim, you have a great rest of your day.
Thanks. You too.